Well, early reports indicate actress Brittany Murphy died of natural causes, but large amounts of prescription drugs from antidepressants to anticonvulsants were found in her bedroom. So could this combination of drugs have caused her fatal heart attack? We are joined right now by our medical panel, Dr. Jeffrey Lieberman, Chief of Psychiatry at Columbia University Medical Center, Dr. William Abnett, Chief of Metabolic Surgery at Mount Sinai, and Dr. John Salerno, a general internist. Okay, my ER doctor friend, told me that the worst possible thing you can do is mix a bunch of prescription drugs together because you just don't know the interaction that it could cause. So do you think that's what happened here in her case?
Well, the information as it's come out is still incomplete and fragmentary, so it's highly speculative. But those bottles that were found and reported by TMZ is accurate information. She was taking multiple things that do have potential consequences if taken too much or in combination with each other.
And there's some speculation that she could have been anorexic or bulimic. How could that contribute to a heart attack?
Yeah, I mean, that's a good point. One of the things we look at Patients Medical at my office, we do glucose tolerance tests. We look at hypoglycemia. It appears she had that. And as my ebook illustrates, it's drsalerno.com, drsalernosdiet.com. We look at the problems with hypokalemia, which is low potassium, low magnesium. If these levels are low and hypothetically she is dieting, she's not taking enough fluids, they'll cause a fatal cardiac arrhythmia potentially, and that may also be a cause.
And an electrolyte imbalance, wasn't that a possible cause as well?
Yes, there were multiple medications that were reported, and one of them in particular is a medication called Tegretol, which can be given for nerve-type pain. And that medication in particular can cause your sodium level to decrease. And in addition, she was on, if these medications are correct, an anti-inflammatory medication that can inhibit adrenal gland response. And the combination of this could have been lethal in that it could have led to a low sodium level that could have led to an electrolyte abnormality leading to cardiac arrest. So that is one plausible explanation as to her death.
Courtney, I would just add that this is really largely speculative. This is an ME's case. There's an inquiry going on. The information has not been verified and is far from complete. I think the first decision point is was this possibly something that's natural causes? A 32-year-old person, it's less likely, but not impossible. Or was this something that was a result of either a self-induced or an inadvertent error in terms of drug effects?
Yeah, can you reassure us, though, that 32-year-olds for the most part are healthy and not going to drop dead of a heart attack?
Yeah, I mean, one of the things we do is we like to look at echocardiograms particularly, and just general cardiograms can pick up some of these abnormalities pretty early. So we advocate someone that's just starting an exercise program, for example, to get an echocardiogram, get their electrolytes. It's a simple blood test. It can look at magnesium. It can look at the structure of the heart, and I think it's all preventable.
Doctors, thank you so much. Brittany Murphy is going to be buried today at Forest Lawn Memorial in Los Angeles. All right.